5 barriers to effective couples therapy. The popularity of couples therapy has been on the rise since the 1980s. But how effective is couples therapy, and what do you need to be aware of when deciding if couples therapy is right for you and your partner? In the 1980s, couples therapy was around 50% effective, which is not such a strong statistic. Today, with the advancements in overall mental health and relationship research, along with more effective treatment approaches, the overall success rate is up to 70%, according to the Journal of Marriage and Family Therapy. Now that's something to write home about. But why are there still so many couples that experience little to no progress in therapy? Besides the scenario where one or both partners are just not invested in doing the work, there are 5 general reasons that contribute to ineffective or even harmful couples therapy. Number 1, abuse. Any level of physical, emotional, or sexual abuse that is occurring in a relationship should never be treated in the context of couples therapy. This is an individual issue and requires individual intervention separate from couples therapy. The risk of harm and continued re-victimization of the partner is extremely high if attempting to address couples therapy. Number 2, an active substance abuse or addiction. If one or both partners have an active addiction, this is an individual issue that must be addressed before couples work can be effective. Number 3, an undiagnosed or untreated mental health disorder or past trauma. Diagnoses or trauma left untreated can be a barrier to couples work. These are also individual issues that require individual interventions. Number 4, an ongoing affair of any kind. An affair, whether emotional or physical, will impact the effectiveness of couples work. Attention will be divided and lack of commitment will be a barrier to progress. Number 5, active use of pornography. Pornography usage at any level negatively impacts the brain and nervous system, which stands as a barrier to authentic connection and safety in a relationship. In addition to any of the above client-presenting issues, a final factor in couples therapy ineffectiveness can be the lack of expertise of the therapist. Obviously, this is close to my heart. Couples work is a specialty, where licenses and certifications are a must with proper experience and training. Too many therapists advertise they do couples work with little to no training, which leads to a lack of progress or even harm. To find a qualified couples therapist, look for the LMFT license in Texas or LPC LCSW license that have additional training or certifications in couples therapy approaches, such as Gottman, EFT, or restoration therapy, just to name a few. Thanks for listening. Come back and see us.